I'm excited to be here and talk through some of the materials that you are working on, or some of the plans for materials that you currently have in process. So I'll pass it over to Maeve.
Hi, everyone. Good afternoon. My name is Maeve. I am on the communications team here at NASDAQ. Also just excited to hear about everyone's programs, get to listen to everyone connect on what's been successful, what's been difficult, and just really excited to hear from you all, chiming in and speaking in the chat and being able to bounce off of each other a bunch. So welcome, and hopefully this will be a great discussion.
Thank you, Maeve. And then we have Sade and Meredith on the call as well too from NASDAQ. If you'd like to introduce yourself, be awesome.
Hi, everyone. Sade Lewis here. I'm the Associate Director on the Drug User Health team. And I am just here today to provide, support, an extra set of ears. I'll be listening around some of the considerations and the target populations you all are working with, so that in the background we could potentially put some resources together for you moving forward. So ideally, we want you guys to connect, talk about the gaps that you have around outreach materials, the challenges and the successes, and then I'll be mulling in the background to try to figure out if there are any additional support or resources we can provide based on what I'm hearing today. So really looking forward to a rich discussion with everyone.
Everyone, I'm Meredith McCarthy. I'm the associate on the Drug User Health team. I support Abel and Allison and Sade and all that they do to support your programs as part of the project. Today, I'm just going to be here to take notes and, as Sade said, to be in the background taking in all the considerations that you guys have. So yeah, I think we're going to have a great discussion today.
Yeah, thank you guys for introducing. Yeah, so we kind of want to jump right into it. I think this is a perfect time for the folks on the call to drop in any materials, any documents directly into the chat. We can display those materials and walk through what the thought processes were for creating it, what considerations were made, and yeah, how the educational material came about. So feel free to drop in. For those that don't have materials created, we'd like to call on you to talk about some of the processes that you currently have for creating materials. So. You take it away.
Okay, folks, maybe we could, go ahead. I see Mark has his hand up. Go ahead.
Now, I'll just say, forgive me, I'm away from my office. I'm one of the field offices. So I don't know if I can maneuver my email to copy something. I will give it a try, but if I end up getting cut off as a result, just chalk it up to trying to maneuver this phone. Our document primary that we've been giving away was developed when COVID first hit. Most of the new stuff now is really because we do have a strong word of mouth. And then the RV, I don't know if you can see it. I think there's a flyer of the RV or a poster of the RV in the window. So everybody knows that on RV. And it's going to get noisy, so take that off. But I'll try and attempt to do that. That way I can just go back into the background and listen.
Hello, everyone. So I guess I'll just jump in real quickly to let you know why, primarily while I'm on the call today, is to get some ideas of you guys' material for folks that are already up and running and are somewhat successful, I call that successful because you're already up and running with some materials. So that's why I'm here to like get an idea of the type of materials that I think the consumers would like to see that's eye-catching. Sade and Meredith showed me one flyer that I was blown away with the other day. And if you have any suggestions of like if you guys had to get permits and things of that nature, that's that would be very helpful for me here in Washington, D.C. Thank you.
And let's pull back from the process of developing materials a bit, because I know folks are all in kind of different stages of the process, but let's talk about kind of the topics that folks want to hit in their outreach materials. I've seen a lot of back and forth on the tier 1 listserv. I've seen a lot of work with the tier 2 and 3 folks with their coaches kind of talking about the types of things they want to see fact sheets and handouts around. So maybe let's kind of just start there. What are kind of the topics that you need fact sheets, handout, pamphlets around? And then we can go from there. Go ahead, Krista.
Yeah. So we are definitely in the process of gathering information, I guess, around what's preventing folks or what the hesitancies are. And so we've collected some information, just like, just listening to people, and then we want to create our materials specific to respond to those concerns, and which is going to be tricky because I think there's not always like a very clear answer to some of the things we're hearing, but we want to make sure that our outreach materials really speak to our audience. And we know that, it's not the stuff that the health department is putting out. Those are not the concerns necessarily. They're more unique. And so we're in the process of gathering information, I would say.
Go ahead, Emily.
Yes, hi. So I had uploaded our little COVID card that we've been using here. It was provided by the state, but like everyone else has been saying, we've been looking for more fun, eye-catching handouts, but of course, you can't find those on the CDC website. So this one, though, it just kind of basically says that, vaccines are free to everybody. And then the QR code that we put takes them to a link where they can search vaccine locations near their address. So I thought that was kind of cool. I know the QR code could be also a bad thing, but that was our card. And yes.
See, we have hand. Go ahead, Liz, if you'd like to jump in.
Hi, everybody. Sorry, running around a little bit. I just got back from Mobile Exchange, so I'm listening though. I threw into the chat our vaccine hesitancy one pager that we've been giving out to folks. We're really trying to talk more about incentivizing the conversation about informed choice with vaccinations than we are trying to kind of push towards a, vaccination, yes or no. And we're trying to, so if you check out our vaccination hesitancy page, we're trying to adapt that for more rural areas in our state, and just kind of having those open conversations with more rural people who use drugs, because it's a different kind of conversation than the hesitancy that we had in this one. I think that's it. Oh, awesome. Thank you.
Yeah, thank you for sharing the one pager. It looks really awesome. And I love the conversation around considerations of rural versus urban settings and how different the communication styles can be. Can you or any other organizations talk to what types of considerations or what types of planning might go into creating a one-pager?
I mean, I can jump in really fast. So what we did, our lovely marketing manager made this because they are super, super talented. But we really wanted to make sure that it was like clean and concise in the one pager. I think the most important thing for the folks that we serve is that they can look at something and have it be really visual. So they're like getting those kind of fast facts. So in that one pager, we really listed out like the safeties of the vaccine, and then like made sure that a separate section was like the side effects of like things you could experience. I know that specifically for what we're doing with this grant is we're going to be purchasing incentive bags for, like, I'm calling them detox bags because they're going to have everything for detox and plan on keeping them on me, but they're basically like after COVID vax bags. So they're going to have Imodium and Gatorade and just things to keep you comfy while you're going through the vaccination. But I think, I'm not sure if it's listed on there, but we really, really wanted to make sure that we highlighted the piece about informed choice and the education around it, more so than anything else. And, you know, just trying to keep it simple with our color scheme and everything like that. If anybody has any kind of question, I'm totally willing to answer the best I can.
I know Rachel had her hand up. I think you're still on mute. Go ahead. Oh,
Hi. Okay. Hello, everyone. My name's Ray, and I'm working as a visual artist down here in Southern Arizona. And one of the things, I'm primarily a photographer, but I'm working to help create some of these materials. And one of the things I just wanted to share with the group is, so oftentimes with these QR codes, if you're having an emergency, you know, it's like you need a phone in order to read that code. And I find a lot of things that are being designed rely on that Q code. And I also find some of the materials that I've been collecting as inspiration. Oftentimes they're putting so much information in such a small font that you can't even read it. And so sometimes I feel, the other part of this situation that I feel is, how do we also give people hope to start their journey towards health, you know, to break the cycle of addiction, but also to be safe. The other thing that I've noticed is a lot of the materials are very much don't show people of color or dressing, like, let's say here even in Arizona with our indigenous peoples, or multilingual. So I think sometimes that some of the pictures or imagery could be more inclusive. And so these are things that I've been noticing as I try to gather information. I also have noticed that a nice way to share more information is to perhaps by using bookmarks, because it's a little bit more information that you could either fold and include with your materials. So that's something, you know, besides like a folded over book business card, or to think about a bookmark, something that you might actually save and not throw away. So those are just some of the things that I've noticed from as a designer or person who will be working to create materials to inspire our most vulnerable populations on a pathway to health. So I just kind of wanted to share that with you all, because even I asked some of my friends who are from the reservations in Southern Arizona, and definitely have that as an issue, you know, our indigenous peoples here. So I'm just really grateful for all of you for what you're, you know, this important work that everybody's doing. And I'll look forward to sharing some of my designs or information as I help develop it. And one last thing is yesterday, I sat in on another talk about how poetry can also help inspire people because it speaks to the heart. And I thought that this might be another way for us to reach our different groups of people culturally, as well as like veterans of different ages and different cultures who are affected by these issues of addiction. So I just, thought poetry is another way of helping people to heal, and maybe adding something, like a little quote that might inspire people. So those are a couple things to just share with you guys. And thanks so much for this important dialogue.
Yeah, thank you so much for that that input. I think you raised some very, very, very good points around design, specifically culturally appropriate design, and the effectiveness of seeing images that reflect your culture and that you can associate with, and how they may affect the digestibility of some of the information on the educational material as a whole. And so I guess that brings me to a question for the group. How
Hold
do
on
you?
1 second. Abel Soul had their hand up for a little while, so I want to make sure.
Okay, sorry.
No, it's totally good. I just I dropped WinCap's trifold. We kind of created a general overview of like COVID-19, as well as like vaccine myths that we have heard specifically within our interactions with our participants. And so we kind of went through and made this trifold to kind of provide information, but also kind of like debunk some of the myths that we had conversations about specifically. It's kind of like our first wave of information putting out with this part of the grant.
Yeah, that's really awesome. I like, I guess that brings me to another question as well for the larger group. I love how the resource has been created based on the conversation you've had with your participants, engaging maybe their interests or some of the myths or some of their communication styles. And so I guess I just wanted to bring to the room, or ask the room, how, or what processes do you use to sort of gauge what type of conversations are happening within your participants, or what type of culturally appropriate methods you should take in creating some of these designs? Are there surveys or just individual conversations? Yeah, and that's sort of open to the room.
Is it okay to talk?
Yeah, definitely. Jump in.
Do you guys remember, like when I was a kid, you'd always find these things flying around, like thrown on the street, like it was like a mini comic about Jesus. And it's almost like, I feel, again, I've been kind of researching again, like the demographic and who's this group of people, and again, it's from young people to elders. But I also felt like, again, what is the level of literacy? Or if you were in the moment, what is the picture, almost like a pictograph, that if you needed to act quickly, that you understand what are the 3-4 things. I'm going to grab you guys this one thing real quick. For instance, this was something here in our town of Bisbee. This is for Firewise information, what to do in an emergency. But see, they have like a picture that's inspiring, like a rainbow of hope. 1, 2, 3 things that you need to get, the logos, and then more information. So this is like a door hanger. And the other thing for these like safe kits, I've also noticed that we're making lots of plastic trash, which, kind of concerns me in terms of the environment. So I'm kind of being inspired to think about how do we distribute kits that could then maybe use like a paper bag that then has a message that then could be wrapped for the different kits. Because then if you have to throw it away and then you're like, oh, hey, that has a statement on here that tells me how to use this thing. Or, oh, wow, maybe today's the day. I think I might try to be, go clean. Or who do I call if I'm feeling I'm feeling like I want to take my life today. So I'm also trying to think about, maybe Japanese origami type, folded pieces of paper that could be more effective with this is my little weird idea, is like this crazy, like a cookie container. Let's see,
Yeah,
then you can
thanks,
just stick
Rachel.
it
I think
on.
there are tons of different kind of ways that we can think about being more environmentally, friendly around the distribution of our kits and materials. So that is a great, a topic to bring up that's really helpful. I just want to, I think we have some other hands up, so I just want to make sure everyone has a chance to contribute. Go ahead, Mark.
Thank you. I apologize. I don't know, like my muted or something like that. But yeah, we had a couple of severe distractions, and it really bothers me because, and not to get off note, but I have to, because if it was a one-off, it'd be, I'd say, hey, just chalk it up to the individual. But I've got like 4 individuals on, either outside the property or inside the property that are just like severely tripping out as a result of the product that's on the street. And I mean, like one just like out of character, not, on their feet, screaming, bouncing, the whole 9. So it's really, really, really distracting and just of great concern to me right now. But to get back to try and take part in the call, in addition to the brochure that I sent to you, actually, Sade, we recently teamed up with a company, Sergo Ventures. I don't know if anybody else knows anything about them. Let me put it out there, look them up. They have a bunch of stuff that they developed that actually my staff has downloaded, and there's a bunch of stuff that's available by QR code, and there's an incentive that has come along with it while we're waiting to give people their results, that they can they can invite other people and receive additional incentives to invite other people. Things are, for us, are moving well. As a matter of fact, my staff's in another training today, or else they would be on a call. I'm really proud that, we took delivery of our vaccine storage. So we're ready to now put our data loggers in the storage units. And I'm sorry. We're gonna, put the data loggers in our storage units, get those set up. And, we'll be able to hit from 2 sites, the main site here in the drop-in center, then the RV, as I said. And things are, I will, by the next call, or with my staff on the next call, they'll be able to forward that information in the sites. I don't have my laptop, so I'm like severely crippled with this phone. But that's where we are.
Yeah, we will definitely circle back to get the information on the company that you're working with. But I think you also brought up another really important consideration is that you need materials for different points of the process that you're engaging folks. So not just before vaccination, but do you have something for them to kind of look at and read and engage with while they're waiting for their results, while they're waiting for their friends? So, there are definitely other kind of points, engagement touch points that we should be thinking about in terms of these outreach materials, not just when folks are, showing up for the vaccine clinic. So
Yeah, have some iPads also, not iPads, but tablets that we picked up, for those who have their own phones, so that we can make sure, we engage has the ability to have access to this other information.
Yeah, thank you for that. I think I see a lot of conversation in the chat as well too about method of distribution of these material items and how that may affect the composition of it, both the wording, the designs, and things of that nature. And so just want to see if anybody can talk to what considerations you may make for a flyer or a fact sheet that a staff person may be able to walk a participant through.
Hi, everyone. This is Tamara. I'm part of Bronx Mobile, a harm reduction mobile bilingual organization that started out as a mutual aid anti-racist collective, and we still are that. But as we become more formal, we're also a harm reduction organization. So what I would say is I dropped into the chat earlier today the resource sheet. Our folks are all people who are living on the streets, unhoused, unsheltered. About 70% are monolingual or bilingual Spanish speakers. And so what we find super useful is to basically include the sheet in each and every single outreach bag. It's not whether you ask for it or not, you get it in the outreach bag that has the naloxone, that has the fentanyl strips, that has the syringes and the urban living supplies and the food that we distribute. And it makes it a little bit easier because it's not about whether the person at that moment is ready to read the materials. What we find is that people, and I think this is an assumption that we make in harm reduction, is that folks don't ask for it, don't want it, but we find, thank you for sharing that. What we find is that folks actually do read it. And the next time we engage with them, maybe not that following week, but in a month, they'll be like, you gave me that info sheet, I lost it. But you have the detox places listed, right? Or we get feedback like, I was treated really badly at this shelter. Do you have other ones, right? So we get feedback in real time around whether our resources that we list make sense, whether they're culturally appropriate and linguistically centered. And so this is a living document, and it literally changes month by month based on the feedback that we're getting from participants, as well as other providers. And what I would say is that it's in Spanish because there is so much information out there in English and so little in Spanish. And so because we are a really small team, we decided to just focus on the Spanish language. So titles of organizations might be in English, but the descriptions themselves. And we do get folks who are like, I don't know Spanish, could you read it for me? And we do, and we do get requests sometimes to develop this in English, and eventually we will. But again, because we're such a small team that is still very much volunteer driven, we haven't been able to do so. But anyway, I shared this with you all. For now, what we do have around COVID-19 is basically information on where to get it. There's a phone number and a resource list listed at the end of it. But we are developing, and that one will be bilingual Spanish-English on vaccine hesitancy, as we're seeing it right now among our folks. So again, this is very New York City specific. very appropriate in terms of the people that we see within Bronx Mobile. I will say this, we've only been in existence for a year, all right? In April, well, we've been in existence a long time. We've been in existence since 2018, but we've only had our syringe exchange program waiver for a year, and we are at 800 participants. And every weekend we see between 100 and 200 people. So I just want to name the need. That means that there are between 100 and 200 flyers each and every single weekend distributed with this information. That's it. Thank you.
Yeah, thank you for sharing so much. Yeah, I love that they get the material each and every time they come into the office. I think consistent messaging is the best type of messaging, right? And so I saw that Sol had raised his hand.
Yeah, I just want to piggyback off what Tamara said. Like we have technically 3 locations. We have our downtown location in downtown Asheville, one farther out west in Franklin, North Carolina. And then we also have a mobile unit that goes to a lot more of our even more rural areas of Western North Carolina. And we have a similar experience where we have our bags that we put our supplies in, and that's where we put our information. And we found that that's almost always the best way to communicate with the majority of our participants. If we have any type of information that needs to get out to anybody in North Carolina who benefits from our services, not just from our direct participants, because there's a lot of secondary exchanges that go on with people picking up and then sharing supplies with individuals or handing them out to other individuals in areas. And so we've put our trifold in. We've also put information about local crisis services and other, like if a support group moved locations, we'll put it in. If there's a spike in overdoses in a specific area, we're putting that information in. And that not only is contributing to the conversations we're able to have at the door, but sometimes, especially because our services have had to move outside our building due to COVID restrictions, we've been able to have that conversation, maybe not like face to face, but the conversation is continuing to when they get to a safe place where they can calm down, relax, and actually like go through the materials that we've given them. We still try and make sure that we're having detailed conversations with individuals, but a lot of times they're either in a rush or, you know, a lot of stigma can happen just from even going up to participate in our services. And so we found that this is a way to meet them where they feel most comfortable when they're actually in a place where they're receptive to the information.
Yeah. That's awesome. Liz, I see you have your hand up as well.
There we go. I just wanted to share really fast. The thing that we've found amazing for our folks is we have like little wallet cards. And I know somebody probably mentioned that already, but the cool thing about these is, so we have different resources. We have one that's titled Shooting Up and Not Fucking Up. We have Clean Caring for Minor Shit, which has referral like info on the back that you can fill out. And then fentanyl testing, strict directions, safe sex, and my favorite, the safe snorting card, because on the back of the safe snorting card, it says, have you sanitized this surface? Because it is hard plastic, so you can keep this in your wallet and use off of it. So we have been utilizing these amazingly because folks, you know, throw them into their wallet and will be able to remember like, oh, this is how I stay safe when I'm booting. And then this is how I can, you know, also stay clean while I'm snorting. So we have them for every facet. We're developing one right now for safe snorting, but we found them so incredibly useful, and I just throw them directly into my snorting kits and my like safe injection kits, and you know, folks keep them on them and they love them.
Yeah, that's absolutely awesome. I've been hearing some really innovative materials. I saw a door hanger brought up earlier today. Those cards are awesome in their utility and spreading education on different topics. So I don't want to cut this conversation short. And I do think there will be plenty of opportunities for us to reconvene as a group to kind of talk more through some of these processes, considerations, different types of materials and how they're being distributed. But I do want to open up some space for Luna from Next Distro to give a presentation on some of the their process at Next. So.
Yeah, thank you. Can everybody hear me okay? Yeah, okay, great. Yeah, so it's been great hearing kind of what y'all have been working on and also some of the considerations shared from NASDAQ, because these are some of the things that guided how we created our resources and how we kind of got this going. I'm gonna share my screen just so I can show my presentation. Give me 1 second. Share. All right. Okay. Do y'all see the presenter view or the PowerPoint?
We can see the like presenter view.
Presenter view, yeah.
View? Okay, thanks. Sorry. Sorry, give me 1 second. I'm just trying to fix this. Okay, perfect. Yeah, so everyone should be able to see the actual presentation now. Great. So this project started from February all the way to August. So it took us quite some time, which is something that is okay to expect when you're making so many resources. So just an overview, we had 2 content experts, and I was the bilingual one. A lot of these resources were made in English and in Spanish. We had 1 graphic designer, which was really, really helpful to kind of the format of these resources. We also had 8 community collaborators who created 11 different resources. And these community collaborators not only created content, but they also developed the visual. So if you have an opportunity to include other folks who are open to volunteering, or if you have that funding, it's something to take advantage of, especially if there's a lot of different things that you are considering are important to touch on. So to kind of give a little overview, we presented it in 3 different ways. So if you go to nextdistro.org/resources, that's just our general resource page. And you can kind of go through it through categories and with tags, which helps make it easier for folks who are looking for resources. Our /resource launch page was giving more of a background about who these collaborators are. And then launch resources is just a page where you can find all the new things that we've been able to see. And also just to give a shout out to Bronx Mobile and Tamara, who were one of our community collaborators, and we were able to make one of the first Spanish language fentanyl test strips, which was amazing to do with these folks. So this is just so you could see what the website looks like. This is the /research launch page. I do want to give a caveat that since Next is an online-based organization, a lot of the things that we do are online, which is why we have so much, such a dense resource page. So these are some of the topics that were created from the content experts and community collaborators. These are things that we found after doing a needs assessment. So things from a more condensed stimulant overdose page, how to identify signs of counterfeit pills, at-home withdrawal management, and route of administration specific. And another thing that's kind of important is like kind of thinking, how long do you want this to be? Again, because we are an online based organization, their participants may not always have that one-on-one time that you might have when it is like an in-person program. So that's why you'll see some of the resources I'll show later on. They seem a little bit lengthy, but we try to keep them to one page, but also just gives folks time to kind of read through and keep it with them. Needs assessment. So what are the needs of the organization? What are the needs of your participants? If you do have community collaborators, what are their interests? And then what do you, as someone who is a part of this program, think that is needed? A lot of times, you know, you'll talk to participants and they'll tell you this, you hear the same thing over and over again. So those are kind of some ways to kind of start thinking about what it is that you need. For our participant survey, we want to know, what do they already know and what don't they know? Look at demographics. I saw someone mention that earlier. That's also important to know, like, all right, if we do, how many Spanish speaking participants do we have? Do we have participants who speak other languages? And that can help guide. Some of the questions that we included in our participant survey was, how prepared do you feel to respond to an overdose not related to opioids? And this informed us to create that stimulant overdose over amping page because it kept coming up. We started through our demographics, we saw a lot of folks were using multiple substances. They weren't just using an opioid or just using a stimulant, or they had friends that did. So we want to be able to not only support people in, you know, taking care and making decisions for themselves, but like a lot of the times people use in community, people have their friends, their cousins, their family. So it's not just about educating the participant, but how they can support their other community members as well. We did think a lot about how do you like to receive information. A lot of folks do use smartphones. So we also have to make sure that whatever we do create can be easily read on a phone. So we had like 4 different people. Somebody had an iPhone, somebody had an Android, or someone had a more expensive, some had a more less expensive phone, and that really makes a difference in how you can actually do on it. So that was some other considerations in addition to our participant survey, and then finding those common themes. So for resource creation, some of the things we kind of went through, there was a lot of drafts, feedback, and edits times two. So I pointed that out because you'll have something and it's important to talk to other folks and not just like be like, this is what it is. Show participants. If you have a friend who works in another org, you can also show it to them, you know, as you kind of want to have as much feedback as you need, so that you can go in and make those edits. I recommend using Google Drive or any type of these online organization. I'm missing out on the word, but these like kind of organization formats, because it helps you share it and get that feedback, be able to do your drafts over and over again, and also check yourself to see how things have changed. I've noticed a lot for me, I'll like write something and then I'm like, no, I don't like this. And then I'll go back in and I'll be able to look back and like, actually this fits with this final draft now. And also when you're supporting your community contributors, a lot of what we did, in addition to working on our next distro specific creation, we also helped the community contributors with, they did the majority of the work, but we would go in and give edits and give recommendations and kind of have these conversations to make sure that we're kind of on the same page of what the goal of this will be. So for our research creation for bilingual resources, as you saw, the majority of our resources are in Spanish and English, not all of them, but a good chunk of it. You want to know cultural and regional differences. One thing that I worked on since I translated all of them was to really think about I know that slang changes here within the US with different Spanish speaking communities, but also depending on where folks originate from. So I would put maybe like 3 or 4, like heroin, also known as manteca, or, you know, all like the different versions of like what could be used. And it does make it a little bit could make it a little bit lengthier, but if it's going to help folks actually know what we're talking about and make them feel like, oh, okay, you know, this is meant for me because they're using the type of slang that I might be familiar with. Also thinking about formal versus informal, I feel like a lot of resources sometimes are just very formal, and, you know, I like how someone used like shit and fuck, and like, just, I feel like using these terms just make it seem like not having to be over medicalized, and, you know, being like, this is just kind of how it is, and this is like normal, like substance use is a normal part of human life, and it looks different for everyone. So kind of going through that informal route of language, I think kind of helps with normalizing that part, and also kind of working to destigmatize and reduce some of that self-stigma that we could develop as we kind of like try to learn more about how to be better drug users. And also something to note when it comes to English and Spanish is that content length will change. I'm going to show this next image. So on the left, I have the English and overamping, and on the right, I have overamping in Spanish. And as you can see, the one on the right, which is the Spanish one, definitely looks a lot longer, because there are certain words that you do have, certain sentences do have to be a little bit longer to actually get to the point that you want to be. But what I think is also really beneficial is like if we have feedback and we start engaging more with these community members and participants who do speak Spanish or who do speak that other language that we're trying to support, you know, kind of get their buy-in and be like, hey, what do you think about this? What's your feedback? And note that. I think with all of our resources, we shouldn't just like, it's done once and that's it. You gotta kind of be open to making those changes, which is what we're kind of considering now a year later with our resources and how we can condense them and make them a little bit more straightforward. This is another one, English and in Spanish. This one's from a collaborator. This person, they not only created the content, but they also did a lot of the art. Google Documents is a really good way for kind of tracking those changes and everybody collaborating, working together, and also giving ideas about design. I'm not a design person whatsoever. I find it kind of difficult, but as you're creating content, keep that in mind of what you want it to look like, and be open that that might change as you kind of go through it pretty often. So you might see a familiar face. So this is a video that we did, and we worked alongside Bronx Mobile. Bronx Mobile did a lot of the content. We had meetings kind of discussing of the outline of what we would like to see, and then included them in this video. So highly recommended. Another thing, if you do make videos, I recommend to please add subtitles. We did subtitles in Spanish to cover that. You know, it could be if someone can't hear because they're in a place that's like public and they don't, you know, they can at least read it. So having both audio and visual could really be helpful for kind of like that understanding for folks. So our resources were distributed in different areas. We made sure that a lot of it was also printable. Folks can ask for next to print out the resources and send them along, considering that, again, since this is not like and you can just come to the office or to the program, this is kind of how we go around that, and also presenting it online. If you do present it online and have a web page, you really got to think about like the tags. We spent a lot of time thinking, all right, this is the stimulant overdose response. What are some words that people can Google or that come up when people look for this. And we did this again, English and in Spanish. So it's work heavy, but those are some things that you want to keep in mind. It's not enough to just put them up on your website. You have to tag them and make them actually reachable for folks. Highlight resources. So we use social media to share some of the resources, and we tagged the creators and tag collaborators, and that helps to kind of get it out there more for other organizations to see, for other people who use drugs who might be interested in seeing. That's I think one of the benefits of social media. It's really easy to get information out there and share with people, and also hold virtual events. We did 2 days. We did 2 days where we would talk to different folks who were a part of this and just kind of talk about, why did you do this resource? What did you learn from making this resource? How would you do this differently? And that's just another way to kind of get it out there when you do want your resources to be shared a lot, which is what we wanted to do. And then, how do we know if our resources are helpful? Participant feedback is pretty straightforward. Next has an option for folks to ask questions and send feedback about the resources. So, if you're talking to folks, kind of keep that in mind, note something. If you can even walk through a resource with a participant and keep that in mind, and ask them questions about how they would like it to make it better, that would be important. Like I mentioned earlier, this is kind of the process where we are now. We've been getting some feedback from different people about oh, but I have this question, and realize, hey, that's not covered in this. So then trying to think about, what did we cover, what did we not, so that we can keep improving these resources and get the information that people are kind of looking for. And then other feedback, I think spaces like this are amazing. To kind of, I wish I had this space, or there was kind of something like this where I can get a bunch of people and come and look at my stuff. I think it's helpful. We sometimes stay in our little bubble and don't notice things. So that's another thing that kind of I recommend. So it's just a bit of what Next did for this very long project. So if anyone has any questions, I am happy to answer them. Thanks for listening.
Thank you so much, Luna, for the presentation. There's some wonderful, wonderful ideas in the presentation about intentionality, getting to know your demographics, and really some cool ideas around garnering feedback from participants, and then some considerations to make for distribution models, like where the materials are going to be distributed and how. And so as we kind of round out this session here, we do know that materials development and outreach development is going to be a through line for a lot of the projects, or just for harm reduction programs in general, and that is a consistent process, and something that we will continue to work on throughout time and just in general. And so I wanted to ask a question to the crowd about what can we do to help, or what would be most helpful in supporting your work in this space? More funding. That's always an answer. But yeah, if some of these if the PowerPoint can get sent out, I think it also would be awesome to share some of the materials that have been shared in the chat today, which we can send out if we are permitted to by all the folks that shared, but also to visit Next Distro's webpage to go look at and look through some of the resources in their library, as there's a ton of really great resources just in general. So thank you all so much for joining us. Yeah, and so I don't know if anybody else from NASTED had any final words before we jump off here.
Just thank you everyone for your time, your participation, and especially your engagement today. We had a really lively and rich discussion. Continue to think about what your needs around outreach materials development are, because we are here to help and support you, whether that is connecting you with other folks on the call. We can hold space like this again. We can do working sessions. So, you know, continue to think about what kind of your next steps or needs around this are, because we do think outreach materials are, you know, a big kind of running through line for everyone. And we want to make sure, kind of how we talked about today, you're able to create materials across the different phases of your work. And for the different touch points that you're going to have with your with the folks that you serve and work with. So we are happy to partner and collaborate with you all. We really want to make this less burdensome on you all. So if there are ways that we can kind of crowdsource around developing these materials, we can definitely look at how we can do that. You know, not 30 different people need to be making a different fact sheet on vaccine hesitancy. Maybe we could get like a smaller, you know, working group or something like that going. But yeah, other than that, thank you again just for your engagement, your contributions, and all of the hard work that you're doing throughout this project. It's really an honor to get to kind of serve and escalate the work that you all are doing in your communities.